So I think it's fascinating that suddenly this becomes a very stirring issue for folks. That's one part of it. The second piece is how far do you go in terms of free exercise in regard to these kinds of questions? Because if you assert that, for instance, the Roman Catholic Church can create a scenario where they will not provide contraception for women under their rules of law in regard to the church, can you also say to Christian Scientist employers who carry insurance for their folks that it's okay to provide no health insurance? Because Christian Science asserts that there is no health care, no medical intervention ever acceptable if you're a strict Christian Scientist, that you never would go to a doctor or hospital. That is an unacceptable means of health. You use other methods that are spiritual, prayerful, etc., under Christian Science to heal yourself or to heal those you love. And there have been a number of cases in the courts through the years of Christian Scientist parents and others who have wanted to withhold treatment from their children, and the state has stepped in with questions about the issue of abuse or neglect of the child, and is that happening under this particular practice? So the test of free exercise is always up against the issue of safety, both public safety and individual rights. And it's a very interesting and can be, I think, a very slippery slope in terms of this kind of conversation, because the question will become who gets to decide what kind of health care who gets based on their various religious practices. And so you have a lot of latitude that can be exercised based on that. And that is where this whole question of our democracy and our understanding of the law constitutionally bumps up against the kind of free exercise religious question. The government has to be very careful that it is not establishing religion or religious practice in their asserting of what the law is in terms of protection for individual citizens under this. So it's a very careful legal issue, and we want it to be. We do not want this to become the kind of thing where you can simply say, well, anytime we disagree with religion, we'll just squash them. That's not a world we want to live in. At the same time, we don't want a world where religion can endanger with intention the public welfare or the safety or the health and well-being of individuals in very damaging or dangerous ways. And so there's always a very, very fine line that's being walked in terms of these kinds of questions. Yes.
But in this situation specifically, we're not talking about human sacrifices. We're talking about birth control.
Right.
Ultimately.
Right.
So far, the government has not seen any reason to force Jehovah's Witness, for example, to have a blood transfusion or
Right.
their children,
Right.
because it's against what they believe in
Mhm.
as well. Even if it was their own blood, they wouldn't do that. So I guess my question is about, while I understand that it's an intricate process and there's a lot of pros and cons to both sides of it, in this specific situation, from the church's standpoint, I can see how this feels like the government or Big Brother or whatever is completely encroaching on their rights to practice freely. They're not hurting anybody by saying, our people or we as an entity are not going to accept that birth control has to be part of that plan or anything to that effect. On the government side, I personally feel like everybody should have access to it regardless of what your religion is, because some people can be practicing a religion but not agree with every specific thing that religion holds to.
Right. Right.
And that's how we end up with teenage pregnancies
Yeah.
or women in situations that are less than likely pregnant with children and having all these kids in foster care.
Right. Yeah, I mean, the issue really is whether institutions that are owned by the Catholic Church have to provide contraceptive health care options for their employees. And so it gets into a very difficult question when you're talking about institutions that have both, as you said, people who don't necessarily follow that in their own personal life of practice, and they want access to those kinds of healthcare needs, and also people who are non-Catholic working for those institutions who would like to have the full spectrum of healthcare available under their plan. And so it really does get into a human welfare, well-being and freedom issue for all employees if one group is allowed to say we're not going to, because the question of an individual case of a Jehovah's Witness parent not allowing a transfusion to a child or to themselves or something, that's very different than institutions withholding from entire segments of population certain parts of healthcare, normative healthcare, availability. So it gets to be a very difficult kind of issue, and we can sometimes ring the bell of religious freedom and not be actually that concerned about exercising our religious freedom, but probably more involved in some other process where we have a particular dog in a particular hunt, as they might say. But in any event, it's a very interesting one. I think we've certainly not heard at all the last of that conversation in terms of the national debate. Somebody was going to jump in over here. Yeah.
Well, I think they've negotiated to the point where the Catholic Church does not want to have to pay the copay for the birth control.
Right.
So, but the Obama administration wants it to be free at no cost to the person, to the women. So that's where the real issue is. The Catholic Church, well, I think they've negotiated to the point where now their insurance will offer it, but the employee has to pay for it. So because they don't want to pay for it because it's against their beliefs, but the government wants to say, no, you must pay for it.
Right.
So
right. So that's So therein lies the rub, as they say. Yeah. Very interesting. Yes.
Why is it that we have to have car insurance and homeowners insurance?
Right.
Who dictates that, first of all?
Yeah.
Like, is it
State. I mean, the issue of mandatory car and homeowner insurance is a state law issue.
Not
right.
even.
Not
But
federal. Yeah.
My other thought is with keeping the First Amendment in place, as everyone has different insurances, like whether it be Blue Cross Blue Shield, Aetna, Medicare, medical assistance, why couldn't they kind of figure out if the government wants to create an environment where everyone is allowed to have, should have insurance, or must have insurance, then why can't you say whatever your beliefs are, then it's regulated by your religion? Do you know what I mean? Why can't it be
Right. So
be
everything
protected?
is offered, and you just check off the things you don't want because your religion doesn't permit it. Is that what you're saying?
Right,
Or-
because it's kind of, like,
Yeah.
if I show up at the hospital, the first thing they
Right.
say is, what kind of insurance do you have?
Right, right.
So then with that, that's going to say how much they're going to pay,
Yeah.
because I might have 80/20 or whatever the
Right,
case may be.
right.
So with that, which would still hold true, our amendment is for them, because a lot of times you go to a hospital and they'll say, do you have a living will, and that type of thing. So why
Right.
couldn't you say, I believe in this, and then, that would, you'd still
That
be having your.
automatically dictates what kind of care you would get or what.
Right,
would be-
because they'd be obliging you to,
Yeah.
do you know what I mean?
Well, it's interesting. I think that this conversation is, as I said, is far from over in terms of our national debate, because it certainly has raised a lot of very thorny questions in regard to how we proceed.